Doctor, I wanted to talk about maybe some triggers of migraine. Let's look at this, and maybe you can walk us through it. What's going on here?
So definitely when you have a migraine, it starts off as a headache. Some triggers and some different symptoms are multifactorial. So in the picture that you're seeing now, some of the symptoms that usually occur either simultaneously, or you can start with one symptom and they can have a sequela of different varying symptoms. So dizziness is a common occurrence. You get stomach symptoms, nausea, vomiting, you're feeling uncomfortable, you're having, you know, the prodromal effects. Some people get neck stiffness, some people get mood changes. They just want to be in a dark and quiet room because normal sounds bother them. Normal visual effects, sunlight, it bothers them. They can't really get out into a crowd of people because it's such an intensified pain that they can't really focus on what's going on.
Now, are migraines hereditary? Some people say they are. They are, huh?
So they are. There is a hereditary link. I mean, there's different studies, different recent trials, but there is a hereditary link between migraines and familial inheritance. So usually it's a first-degree relative that we're seeing that have migraines, along
like a
with
mom or dad?
Mom or dad, brothers or sisters, anybody that it runs in the family. We usually find that as a focal point in conversation when we're interviewing patients.
And we have a graphic that I want to show our viewers on who is more susceptible to getting migraines. Let's take a look at that and have the doctor explain exactly what we're seeing. So we actually don't have that graphic, but we do have this one here. My apologies, doctor. Migraine triggers. So what are we looking at here?
So there are a multitude of triggers when we're dealing with migraines. The evolution of migraines has changed. So obviously there's a lot of different studies of what triggers a migraine, but typically what we're seeing is environmental factors. We're seeing certain foods that are triggering migraines, and we can get to that, I'm sure, in conversation. Certain drinks, certain supplemental evidence, like I said before, sounds, certain sensitivities to light trigger a migraine. And in some cases, of course, stress, which is a major role here in the United States, medications that we're seeing as well, and sleep deprivation, too much or too little sleep makes a big difference.